Welcome everyone to today's webinar, How Erlanger Health System Built Financial Strength and Patient Loyalty with a New Patient Engagement Strategy. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So we will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. So you can go ahead and submit any questions that you might have throughout the webinar by typing them into that Q&A box you should see on your screen. Today's session is being recorded and it will be available after the event. You can use the same link that you used to log into today's webinar to access that recording when it's available. If at any time you don't see your slides moving or if you have trouble with the audio, you can try refreshing your browser, and you can also submit any technical questions into the Q&A box. We're here to help with that. With that, I'm pleased to welcome today's speaker, Britt Tabor. Britt Tabor is the Executive Vice President and Chief Financial Officer Treasurer for Erlanger Health System in Chattanooga, Tennessee. He has been with Erlanger for 31 years. Mr. Tabor is a certified public accountant, a board-certified healthcare executive, and a fellow in the American College of Healthcare Executives. He has also filled the role of adjunct faculty member for the University of Tennessee, Chattanooga State Community College, and the College of St. Francis, teaching both at the undergraduate and master levels. Britt, thank you so much for being here today, and I'll now turn the floor over to you.
Thank you very much, and appreciate being able to talk about Erlanger's experience in revenue cycle and what we will be able to accomplish during this very unusual time. No presentation can actually start without talking about COVID-19 impact. Obviously, every hospital in the nation has experienced some impact, and Erlanger was no exception. I'm going to first go over some of the industry benchmark information that we're seeing, and then talk specifically about Erlanger. As a whole, the hospital industry revenues fell about 2.4% compared to previous periods of time. And a lot of this decrease in revenues was based on the elective care that was being shut down. In other words, a lot of the hospitals for elective surgeries had to postpone or completely eliminate those particular procedures, or those, in essence, creating a occupancy availability for those that were very, very sick and did not have that elective component to that procedure. In addition to that, the reason for elective shutdowns was also to preserve PPE. In other words, the supplies that we use to treat patients. Most hospitals had difficulty getting the supplies needed, and so that was a significant burden as well. Obviously, with shutting down electives, that drives a huge margin deficit in any hospital, and Erlanger was no exception. Less than 40% of Americans say they could cover a $1,000 emergency medical bill. We did see a lot of that. High deductible plans, specifically in our market, has been a huge trend. And I'm going to talk a little bit about that later, but that is something to keep in mind as we go through this. With those high deductible plans, unfortunately, a lot of employees sign up for this without understanding the plan and understanding their out-of-pocket. And so a lot of times in our registration area, we are the first ones to tell them how much they actually owe. And unfortunately, a lot of our families are devastated by that amount. So again, I think one of the things that we have tried to convince employers in the region is to better explain those plans, because the hospital is the ones that's delivering the bad news. 33% of Gen X and 29% of millennial patients reported their insurance coverage was affected by the pandemic. And looking at the collection rates for balances over $5,000, they were 4 times lower than the collection rates for patients with low deductible health plans. Again, that high deductible plan comes into place here as well. You see a stat here about the number of families that have filed for bankruptcy due to medical expenses. That has risen dramatically compared to previous years also. 80% of patients utilize healthcare providers or payer websites to look at now who has the best pricing. Because of those high deductible plans, it's become a very consumerism process of saying, where am I going to get my MRIs? Where am I going for my CT scans? My outpatient surgery, orthopedic hip replacement? Who has the best price? People are looking, and we have to stand up and actually provide those numbers for our patients to provide that need, because they're demanding it. 78% of patients said they would skip at least one visit due to the impact of COVID. And we saw that significantly at Erlanger. Giving you some particular Erlanger impacts, our electives were shut down by the governor mandate on March 23rd. So from March 23rd forward, we were not allowed to do any elective surgeries, again, to preserve PPE and to preserve the occupancy availability in our hospitals that may come as the wave of COVID hit the Chattanooga area. We didn't have the wave that people were expecting, so the hospital became pretty much deserted at that point. We were allowed through a government mandate to start our electives back May 1, so we were out about 45 days of doing any type of elective surgery. What that impacted for the month of April, just to give you some flavor to how that impacted, we lost about $35 million in net patient revenue in 1 month. We had a 36% admission drop. We had a 42% inpatient surgery drop, a 70% outpatient surgery drop, and surprisingly to us, we had a 45% ED patient drop. That one took us by surprise. And when I talk about emergency room visits, I'm talking more about things that, while we were surprised, the chest pains, the strokes, trauma, you probably could expect that because there were fewer people on the road, et cetera. But some of the illnesses that you would expect not to be impacted by the pandemic didn't materialize. The issue that we were worried about mostly was that are those people putting off care? Are they going to be showing up in a very acute state and require significant more resources to get them better? And then on top of that, the transparency rule that started January of 21 was mandated, and we had to work in the revenue cycle to get that ready as well. So you had all these financial pressures impacting Erlanger, and it was a kind of a scenario where we had to do significant things. In addition to the things that we did on the expense side, we actually had to look at the revenue cycle. And if you look at the revenue cycle, we said, okay, what is our plan? Just because we're in a pandemic, we can't just stop doing what we're doing. We have to actually get better at and develop a consumerism approach to what we're doing to drive transparency, to drive more business to Erlanger, to figure out how patients can help us get paid more timely and reduce those balances. So, as I mentioned, price transparency is becoming critical because they're taking on more healthcare costs. It's funny that there's a national survey where it showed only 50% of the patients understood their medical bills. And I would even say that that's across all payers. If you look at the Medicare population, I would think that that was probably a much higher percentage, because based on the phone calls that we get, even we've tried to make it more simple. Previously, we were getting a lot of calls regarding about that. And patients want an estimate of what they're wanting to get, what they're going to be out of pocket for, so they can at least help do their budgets and expect that. So they're also demanding customized payment models and financing options. It really is about creating a positive provider-patient experience and looking at it to be having Erlanger as a brand conscious. I want to go to Erlanger because they have this ability to help me with the payment of that medical care. Not only at Erlanger do we want to be known for our quality clinical care, but we also want to be known for quality revenue cycle and ability to take care of those medical expenses after you're discharged from the hospital. And we understand that internally we have to understand our weaknesses, and we were struggling to keep up with the burden to collect the medical cost in-house. We're not set up to be a bank. We're not set up to be a financing organization. We're not set up to do a lot of these things that now with all the technology, a lot of the cell phones, the texting, we were just not able to do that at this point. So we truly wanted to come up with a solution to help our patients, make it as least burdensome as possible, and so that the patient could focus on getting better. And they are, we noticed in our discussion with our customers that they're looking for interest-free payment options to help with them. There's a lot of companies out there that have these high interest rate plans. Based on what we've looked at and known, a lot of those don't work. And a lot of patients view that as high interest rates means that Erlanger is laying on top of already a struggling family that may have ongoing health needs, and trying to really come to the solve the solution of helping our patients. That's what we wanted to get to be known as someone that not only can drive good patient outcomes, but also help them meet their financial obligation. And we do believe that there's options out there. So what was our strategy? So we sit down and said, okay, this is what we want to make sure that we have prepayment for elective services. We want to make sure that our process is in place to make sure that for those patients that qualify for charity care or Medicaid, we have a flawless system to get them recognized as such. We wanted to make sure that there was some digital engagement. In the past, we didn't have a lot of digital engagement. We were very paper-oriented. So some of the things, we wanted to be sort of like the Amazons of the world, where you can text-to-pay options, telehealth, in-out messaging services, etc. We also believe that this had, because Erlanger there was no other provider in this area doing a lot of this stuff, we wanted to make sure that this was marketed appropriately. We did believe that this had a marketing edge on our competitors and and we wanted to get that message out. And we strongly believed on using a lot of the Facebook Erlanger webpage. Word of mouth tend to really go very quickly, a lot quicker than what we had engaged, to the point now where people are asking about it as they walk in versus us having to tell them about it. And then patient financing and expense management, a lot of these things that we're saying, could we do this in-house, or is it better to look for an outside partner? We got to be able to determine there's certain things that we can and cannot do on a cost basis, and we got to be realistic about that. It was important to do it at a very good cost point, but make sure that we were delivering high-quality service when we were doing it. We wanted to make sure that there's real-time eligibility, and what that means is at the point of registration, we wanted to make sure that we're capturing all options at that point versus later after they're discharged or after they've been at home, etc. We found that if you've engaged the patient real time when they're sitting in front of you, the success probability goes up dramatically. We wanted to also help the patient understand their liability, the cost that they're going to have to incur up front. So we put a lot of time and effort in coming up with a price estimator as well. We use other eligibility type software to help propensity to pay scoring. We actually look at that and say, okay, what's their propensity to pay? Do they qualify? Will this help us qualify to get them into a payment plan? Does this help them regarding, are we missing a Medicaid solution? Are we missing other solutions? And we wanted to make sure that, again, from an eligibility standpoint, that we get them in the right bucket on the front end. I also wanted to make sure that they had on-site financial counseling. again, you don't know what you don't know. Based on where we live in Chattanooga, there's a lot of options on other type of funding outside the Medicaid program. So we wanted to make sure that those options are presented as well. Online bill payment, I think that goes without saying that you have to offer that. A lot of the people want that. They no longer want the phone. They no longer want the paper statements, et cetera. And so we had to move into that era as well. And then we believed that truly that this was going to be driving a loyalty type program for our patients. In other words, that they knew that when they needed care, they could come to Erlanger, get excellent care from a quality standpoint, but then on the backside, on the revenue cycle, ensure that they're getting options and ability to pay their bill, their obligation, as it matches their budget. That was key to us. And then in the end, a goal obviously was to enhance our collection rate from those patients that had the obligation to Erlanger. So putting all these together, it was key in coming up with the strategies, and everyone on the team agreeing that these are our strategies and the outcomes associated with it. We did have a lot of these things could be done, through an EHR that you may have on board, but we found that the cost to get the EHR modified to meet some of these strategies was going to be very expensive, and why not use this plug-and-play model for finding a partner that can do this, be cost-effective, and really know how to do it in a timely fashion, because time for us was of the essence, and we wanted to make sure that not only were we timely in implementing these strategies, but it was accurate and secure. And so that's why we looked for a partner to help us do this, to achieve all those plus the items I just mentioned. So before I get into the detail of our success and what we did from a tactical level, just to give you a little overview about Erlanger, we're a multi-hospital system anchored by a huge teaching hospital. We have 7 hospitals across Tennessee and North Carolina. We were founded in 1899, and we're authority, so we're actually a governmental hospital as well as a 501c3 not-for-profit, so we're actually dual eligible, so to speak. We are a big teaching hospital, as I mentioned. We're the only one within 100 miles. We're the only children's hospital with 100 miles. We have a level 1 pediatric and adult trauma, so we're the trauma center as well. And we're certified in Alabama, Georgia, and Tennessee. We have 6 multi-state life force air ambulances, and we're a comprehensive regional pediatric center with pediatric ER, PICU, and we're the only level 4 NICU. We have about 60 neonatal beds on our campus. We are the only emergency cardiac and stroke center. If you look at MedPAR data, you'll see that in this region we're one of the top referral systems for stroke. We're known across the nation for our stroke program as well. We have 834 acute care beds, and we serve patients from 50 separate counties. We have 1,100 medical staff and about 370 employed doctors as well, and we serve about over 750,000 patients annually on the inpatient and outpatient basis. And we've had a lot of growth over the years, and we grew quite quickly, and that's why it was very important for us to get the revenue cycle and these options available, because if you think about it, we grew over 5 years from $600 million of net revenue to $1.2 billion in 5 years. So you can imagine the influx of patients that we saw during that time, and if we didn't have a good revenue cycle process on the back end to collect the patient's liability, it could have been a disastrous growth because growing is important, but if you don't collect the revenues associated with that growth, you can get upside very, very quickly. So this is the problems that we wanted to solve. We wanted to reimagine our patient collections, build our financial strength and our balance sheet, and we wanted to increase our patient loyalty. And so we said, okay, how do we do that? Obviously, with the growth that we were experiencing, again, double-digit growth. In fact, we were the only hospital in Tennessee that was having double-digit growth during this period of time. We wanted to make sure the revenue cycle kept up with that. So how do we do it? We wanted to drive more cash, obviously, and have a greater patient-focused program. We wanted to reduce the complexity of spent managing in-house payment plans. We had that internally in our system. We had a max of 24 months that you could pay. It was a very amateurish built way of doing it. The system was not technology appropriate, I could say, in managing that. And so we were having a lot of delays in payments, et cetera. And we wanted to streamline the process so our early out vendors could happen at the same time as quickly as it was identified as, okay, this is now patient liability. We wanted to make sure that that got to the early out vendor quickly. And then at the same time, all this other was happening, I had a changeover in our patient financial services and revenue cycle leader that left. And so if you put all that together with the growth, trying to meet these strategies and leadership changes, you can imagine the problems that were starting to occur, and we were having to quickly address those as well. We had to do it quickly, and we had to integrate it with our existing system. And we wanted to shift the community perception of Erlanger, because we are the academic public hospital in this region, that it's not just about free care. Obviously, if you qualify as charity under the Erlanger charity care process and policies, we do accept free care, but we want to make sure that people that had the ability to pay didn't come to Erlanger saying, oh, well, it should be free. We wanted to make sure that there's accountability for all of our patients. We had just come out of an Epic implementation, so those people that have done Epic implementations, you know what I'm talking about. Our days in AR were still high at 67 days, and at that point, we only had 63 days cash on hand. And so you can imagine, with all these problems that we wanted to solve, with all these other things, the financial restraints that we had, leadership changes, but I guess why I tell you this is that even though we had a lot of barriers, the team identified the strategy, we wanted to move forward, and we didn't let that stop us say, well, let's wait. Let's wait until this gets better. Let's wait. We didn't have the ability to do that, nor did we want to wait, because we knew that we could be offering a better solution. So what we did is we looked at vendors out there that offer these type of solutions, and we settled with Care Payment. And going just a little about the process, we wanted to make sure that whoever we partnered with had the understanding of healthcare. We didn't want it to be a company that just did retail, that dabbled in healthcare. We wanted someone to understand copays. We wanted the company to understand insurance payments. We wanted people to even understand what an EOB was. And so that was important for us as well. We also wanted to find a company that could work with us on an ongoing support and was very transparent. Transparency was key to us. We felt that for this to work, we had to be able to monitor it on a very real-time basis, because if there were some unintended consequences in this program, we wanted to be made aware of that quickly so we could make adjustments as quick as possible. I feel this is one of the important reasons for anyone looking at this type of option is key, because to be able to adjust real time, because any type of program at this level could get off track very quickly, and you just don't have time to recover if you do that. So we implemented this in a matter of weeks. and we offered it at the point of service. And what I mean by point of service is at the point of registration. So the staff was still asking for payment in full because we still want to collect as much as possible up front. Excuse me. But if they find that the patient did not have the ability to do that, then we actually offer the care payment plan up front. And I want to talk a little bit later about what those criteria are that can to determine if you get into the plan. And it's very easy, actually. You'll see on the right the marketing material that we used, which is very favorable. People loved it. We even went to talk to some of the local employers saying, okay, if your employees come to Erlanger, they have this option, and they can get a care payment card. This was very positive because, it's that loyalty, branding the loyalty to Erlanger, and creating that affordable payment option, and let them know they can come to Erlanger for this. If for whatever reason the patient does not like to do the care payment plan and wants to do the self-pay option, if the balance is not paid in 60 days, that's still referred out to care payment, and they reach out to them for care payment reaches out to them to see if they want to get into the program. That has worked big time for us as well. We converted all the existing Erlanger payment plans to care payment, so we got those off our books and saw a huge cash increase as well. That was positive because, remember, we were not doing it well, and care payment took those over, got it all accurate, and started sending out those monthly statements. We also replaced the payroll deduction. We no longer offer that for our employees. Again, we were not doing that well, and so we allow them to sign up to this care payment plan, and we get all that money in advance, and that's key. Care payment funds the money in advance, has some recourse to it if the patient quits paying, but it does get that money into your hands at that point versus waiting for it to get paid. So it was a comprehensive solution. I'm not going to read through all of these, but you can see that it was very successful. We converted AR to the care payment plan. We decreased AR. We list the payment options on every statement throughout the entire patient journey, so that patient is always on the front of mind of patients as they're getting their bills. The program is zero interest, and there's no application required. Most patients qualify up front based on their propensity to pay. We did give them an option of 6 to 72 months in the payment terms. Hardship is, for those that are extremely hardship, we allow them the 60 to 72 days, 72 months, sorry about that. There is a $100 minimum requirement to be in the payment plan, and it generates significant immediate cash on hand. Great customer service. We've had virtually little complaints, and really just very positives from our patients about very pleased. In fact, we've had patients that have been in tears thanking us for disability. Now remember, compared to this, we were offering only a 24-month plan previous to this. At that point, if they couldn't do it, we were turning over to bad debt. And 50% of our patients fell in that 24 to 36-month window. So you're going, okay, you heard me mention interest-free. That was key to us because we believe that interest-bearing solutions can have quite a bit of negative impact based on what's being offered out there. Erlanger elected to do the interest-free solution, even though that there was some recourse involved. We felt that we were going to get more people compliant, and it worked actually. That people love it, so it was a good decision on our part. We believe that charging interest can kill a payment program. We believe that, again, because when we had a previous, working on a previous plan, and patients, that was the first question they asked us about the interest rate, and that was a huge negative, and a lot of people just said, no, we're not going to do that. So in this particular engagement, that was key. We also wanted to co-brand the solution. We believe that it shouldn't be a care payment coming out from with our patients. We wanted to be an Erlanger co-branded solution, and very positive as well. Again, I'm not going to read through all these, but you can imagine how the left side is a lot more inclusive than the right side. It's a lot more, in my opinion, patient-friendly, and it really ties to that. Remember that strategy that I talked about Erlanger being loyal, the brand, coming back to Erlanger for the options. Again, just because we provide quality care, if we are really bad on the revenue cycle, it can have a devastating impact to word of mouth, and the general population about Erlanger, and will I ever use Erlanger again? But again, key things to keep in mind. You may, when you evaluate a program, you might come to a different solution, but we believe that with our strategy, the interest-free solution was the best, and it was important to do that. And we believe that, and it's come to be successful, that the amount that you're collecting on the outstanding balance truly offset any of these other costs that we were giving up. And so very excited. So for those that in the seminar that are numbers people, so what did that mean? Results are increased self-pay collections. We were collecting about a little over $2 million in 2008 to an average of 3.3 per month in 2020. That's a 60% increase. Huge positive cash flow. And again, keep in mind as we go through all, huge patient satisfaction improvement as well. Reduced the overall AR days from the 68 that I mentioned earlier to 40. Now again, not all of this was tied to this particular strategy, but it definitely had an impact on us meeting the 40 days in AR that we're showing here. Regarding self-pay, it absolutely had a material impact from self-pay AR days from 15 to 5, and you can see the net self-pay net collection ratio, that should be ratio, is 47%. We reduced the self-pay balances from $145 million, that was what was on our AR at gross, to $55 million. And think about that as just an impact going forward. That to be totally transparent, we also had a change in our charity process as well. So not all of that decrease in the self-pay was based on our payment plan option strategy, but again, it was a part of that solution. So from January, as of January 31st, through the implementation process of the first day we got funding, we've had $26.6 million of true cash that's been funded, 122,000 accounts that has been impacted, and currently in the inventory right now we have 21,000 active accounts. And again, I can't overemphasize the patient satisfaction. In any type of significant change in process like we did from doing it in-house versus outsourcing this option, you would think that there'd be some complications. We had very little issues and very little complaints. In fact, now getting sincere appreciation and saying, I wish I'm coming to Erlanger because we know we have that option available. And it really has helped us in the loyalty department, and the word of mouth has spread. And as I say now, when people approach us, we're not having to go over that with them at registration or even the pre-reg. They're asking, can I set this up on care payment plan? And keep in mind that since we've got now the ability to do this online, etc., it's made the process so much easier. And I've been able to use our in-house staff now to do more on the collection of insurance on the payer side, the Medicare side, the Medicaid side, versus having to spend a significant portion of time on the self-pay side. And it's just made a huge difference. And again, as we noted previously, going from $2.06 million in collection to $3.3 million was huge for us as well. What I also liked about this particular engagement is that the initial engagement, you get funded immediately, a lump sum payment on the inventory that's out there day one. Again, that was help. Again, giving them the inventory, let them manage it, see how many people that they can get on the payment plan. Again, understanding the recourse associated with it, but even with the recourse involved, the cash collection way exceeded what we had seen in the past. Lessons learned. There were some lessons learned. Even though I said it went seamlessly, there were some things, explore all options. In other words, as you're picking the vendor, make sure that your strategies are matched with the vendor. It has to be a partner versus just a peer vendor relationship. They have to be working with you, understanding your revenue cycle, and helping you really come to a conclusion of how to really get it really running efficiently and effectively. And use experts. I really can't overemphasize the importance of having your partner to be a healthcare expert. I think a lot of options are out there that, again, a lot of the banking companies offer solutions, credit card solutions, etc. But again, personal opinion and what we found is that the healthcare knowledge was key to help us work out a lot of the solutions. And don't be afraid of recourse programs. I was a little concerned about that as well. And how do you even, when we're doing this, we started this right before our year-end. We're at June 30 year-end, and we started this right at the end of June. And so we got a lot of initial payment up front, and, obviously this has some recourse involved in it, but then how do you estimate for your audit of that? But again, care payment was excellent in helping us give us enough histories of what other companies or other hospitals have experienced, helping us dissect the data, and then again being transparent as those monthly results come in and how to modify our estimates going forward. That was key because, again, you don't want to over-report or under-report. And again, key, if you remember one of our strategies is be transparent. We have to be all about that and where we go. Epic. Epic is a great vendor. It's a great system. It's an expensive system, but it is something that we felt very important with regarding our journey to continue to enhance quality at Erlanger. But there are some challenges with that system with any outsourced partner, and I would recommend getting IT involved very early in the phase of any type of implementation if you choose this route. It was key to us because I'm glad we got Epic involved as early as we did. There was some unexpected programming changes we need to do. If you think about the revenue cycle, it's about a flow of funds, and it's how a particular account travels down this path, sort of like the yellow brick road to the Wizard of Oz. It's going down this path, and it can get sidetracked very, very easily. And so it was very collaborative effort to ensure that we made it to the wizard at the end for success. And if you have everyone at that table, the programmers, your revenue cycle people, you're the partner that you select to outsource, and even some of the clinical departments, because what we found a lot of times, patients were asking their doctors, about care payment, because we use this not only in the hospital but our physician practices as well. And so everyone at Erlanger became a marketing effort for us to get this program going. And so it really was just an education of, okay, not only do we have to educate these people, we have to educate. We have to send out, we sent out email notices to all email users about what we were doing. We educated the board. We educated our employed physicians, our medical staff, et cetera, because we wanted them to know that when someone mentioned Erlanger Care Payment as a co-branded product, we wanted everyone to feel knowledgeable and comfortable, and then, again, know about it at the 50,000-foot level, and then know who to refer that patient if there's further detailed questions that they were not able to understand. And then choose a partner that really understands your business goals. Again, going back to that slide where I talked about Erlanger's strategy, that was key because we used that particular slide to show to all the potential partners, this is what we're trying to accomplish. And if your product or your service or your willingness to work with us isn't aligned, then we need to know that now. That was key because this is how we're going to evaluate the success of the program, is by going back after implementation, after getting through a certain period of time, and we can go back to these strategies and say, did we deliver? And so that was key, and we were, again, very upfront with all our partners or the people that we're looking at to do that. And we wanted to make sure that we found a partner that could guarantee the results. I mean, literally, we wanted someone that had been proven, worked for an academic medical center like Erlanger. Being in a public hospital was key to us, and it was because there are certain things the public hospital has to deal with that some of the other hospitals just don't. And we wanted to make sure that they understood our patient population, because we want to help our patients, again, from a care standpoint, but if they have a patient liability, we want to make sure that they're giving all amount of options to get that amount paid and to get that debt satisfied. And then finally, what are some enhanced opportunities? We started out with one hospital, add more hospitals. Now we're expanding to, as I mentioned, physician practices, ambulatory centers as well. And we want to offer it to anyone that has now any point of access to any of Erlanger systems or centers. This should be the option. Consistency, in my mind, is key. We want to make sure that this is a payment option that we have available, whether you're in North Carolina, whether you're in Chattanooga, whether you're in the emergency room or in our OB unit. We want to make this the known opportunity. Again, getting this cash advanced to us up front impacts cash flow, positive working capital, and it really makes sure that we have someone monitoring that patient liability source. Marketing opportunities, we found, again, that more advertising, you can't do enough. We really believe in that because word of mouth spreads, going to employers, talking about options. We overhauled our statement letters to include care payment on every statement that we send out, even for those statements that people have not elected to do care payment. It's got it on there. Again, want it front of mind on everyone. And then the text to pay option, again, trying to get up there with the Amazons of the world. We want to get. We found that based on the research that more people are likely to pay based on a texting message versus a phone call. In fact, we're finding phone calls people are not even answering anymore, and text to pay seems to have a more probability of payment. And then a portal for patients to pay online. Obviously, as you've seen throughout the presentation, technology is key, and to be able to especially for the younger generation. They don't want the phone calls. They don't want the paper statements. They want to make it easy, fast, quick to understand, and work with us through that particular venue. And Care Payment has been able to deliver that. So when you look at, so you'll say, okay, are you successful? When I mentioned earlier that we compare our results to our strategy, I can absolutely 100% say that we were successful in this endeavor. The cash has been great on the self-pay part of it. In essence, we found that people really do want to pay for their obligation of medical care. And if you can give them an option that's truly understandable, that's truly easy to use, no hassle, that does have extreme interest charges on those, people will step up and cure their obligation. And we felt that that was very important to understand and to really be there for our patients to ensure that they don't view Erlanger as this big collection company trying to go after their home or assets. We wanted to make sure that we work with the patients, not against them. And we found that that worked wonderfully with us and has really garnered a lot of patient satisfaction comments. Our doctors have complimented the process as well. And we make this payment option available for every service line that you have, and obviously for any type of patient liability. This goes to self-pay, patient liability after insurance, cash pay patients, etc. This is truly an option, and it has been very, very successful, and the collaboration has been amazing. So with that said, it looks like we've got about 10 minutes left within the hour, so I'll open it up to the moderator at this time.
Thank you, Britt, for that excellent presentation today. So we will go ahead and begin the question and answer session. It looks like we've already got some questions in the Q&A box, and you can continue sending any that you might have, posting them in that box. So first, Britt, our first question, can you describe what ongoing support has been like?
That has been one of the things, if you remember in our strategy list, that was key to our strategy, and it's been great. Again, I would suggest that the partner that you go with have at the very beginning weekly to biweekly meetings. We're at monthly meetings. We have quarterly reviews of where they are with me. I have a VP of Revenue Cycle that has the monthly meetings, and it is key. And the reason why I say it's so key is because you've got to find a partner that will be transparent, because it's a very complex process to go through, but once you get it going, it goes very fast. But if you don't have someone that is working with you and doing follow-up, if something goes awry, it can be very devastating. So to me, that was one of the key things that we felt from a partner standpoint, you had to show from your experience that you believe in that. And we felt in this example that Care Payment did deliver on that and plus some.
Great to hear how strong that's been there. Next, we have, what did the process of choosing a patient financing vendor actually look like? We really went up the strategies that I mentioned earlier. We sort of did like a Excel worksheet and put that the things that we could do. A lot of it purely is, I guess, subjective in the ranking, but we used a lot of reference checking. We wanted to make sure that we talked for all the partners that we were evaluating. We wanted to make sure, how did they do this? What was the patient reaction? How quickly were they to resolve an issue? How good were they on their estimates regarding recourse? How good were they on patient interfacing? Keep in mind that, you know, it's sort of sometimes a little concerning when you turn over patient interfacing with an outsourced company,
because they're now contacting your patient. And if there is a bad situation that happens between that patient and that outsourced partner, it can go viral very quickly on Facebook and Twitter and all these things. So we wanted to make sure that the partner that we picked had that track record of delivering exceptional care from a service standpoint, and was able to and not only if there was a resolution they couldn't get to bring us back in. We didn't want to wash our hands of those accounts. We wanted to make sure that if there is an issue that we can't get resolved at the patient satisfaction, we wanted a partner that would know that and bring us back in, because we didn't want that relationship to be harmed, and then that patient call our patient financial services department and say, wow, I had this horrible experience with this person, and it's not what we expected with Erlanger. So it was a rigorous committee. We had a lot of revenue cycle people on that committee, as well as IT. I did visit a couple of those sessions as well to educate me on the process. And we did have some of our clinical leaders involved, because we wanted to show them that what options, and they might have understanding of things we're missing regarding clinical functions that drive patient balances, and be able to ask those questions as well. So it was a very good collaborative effort. And we ranked them based on a sort of a ranking, and Care Payment came out with the top ranking.
Britt, our next attendee question is, how were you able to improve payer partnership and continue to build on those relationships?
We actually, because of the high deductible plans, we met with Blue Cross Blue Shield is the biggest payer in Chattanooga. They're probably 60 to 70% of the commercial market here in Chattanooga. So we actually met with them and went over some of the logistics of this program. And so as they're out there, again, not only did we meet with the payers to help them understand it, but we also met with employers that had some of the high deductible plans, so they could understand it as well. And so it really was a collaborative effort, and they actually, from an employer standpoint, got actually great feedback. The payer, less feedback, to be very honest. They were glad of the program being offered, but at that point, when it becomes patient liability, they're sort of out of it. That we got much better feedback from the employer.
Thanks, Brett. Next here we have, does Care Payment take over the account at day 60, or is the patient allowed to age out and go to collections?
We do force, if the patient elected not to take Care Payment on the front end, they now become at 60. We do force that to Care Payment at that point. Obviously, then Care Payment goes through all their analysis, works with that patient. If that patient, for whatever reason, still does not believe in the Care Payment plan, it comes back to Erlanger, and then is turned over to collection at that point. But it does, we do automatically force those at 60 to go to Care Payment. And one of the other things, too, we have an early out vendor that handles a lot of our patient collection as well. We wanted to make sure that our early out vendor knew that at a certain date it's going out of their hands and going to Care Payment. So in essence, I'm trying to create a little competition, so to speak, of urgency, so that they know that they can't let an account stay idle. As people on the call will probably know, an early out vendor is key to any success, but if they don't work those accounts and don't and let them sit, it can be a graveyard for accounts receivable. So it really was twofold in that it gave the early out vendor incentive to work those accounts before it moves forward, and then it gives the patient a final try, a final sort of ability to pay through Care Payment before it gets to the collection process.
Looks like we have time for a few more here. So next, how do you handle low balances that don't qualify for a 6-month payment plan? And does care payment follow up on everything there?
No, those that don't get turned over to care payment. So we do work with those patients. We do not set up payment plans within the system. However, we have worked with, at most point, that's when credit card discussion comes into play. We have, obviously, availability of the credit line, their propensity to pay. So we take all that in consideration. And then there are times when we've made exceptions to that minimum low balance. But keep in mind, I think it was $100 was the minimum balance. And so we really, that's what I like about Care Payment and their partnership. Even though they're guidelines, they've worked with us on certain exceptions. But in the end, I guess what I'm saying is if a patient is willing to pay their liability, we will find a way for them to pay it.
And then lastly here, I think we'll have time for one more. Did you see a correlation between the success of the care payment program and an increase in patient experience metrics?
Oh, absolutely. We're Press-Ganey, and so obviously we're looking at HCAHPS all the time, and specifically Press-Ganey for our registration area. And that's where we saw the biggest increase was that when we started offering this program, our patient satisfaction within our registration and patient follow-up significant increase. And we have seen increases as a hospital as a whole. So I do think that figures into that calculation as well. But the significant increase was with registration and then the follow-up on patient accounts, major improvement there.
That is all the time that we have for today. I want to thank Britt for a great presentation and Care Payment for sponsoring today's webinar. To learn more about the content presented today, please go ahead and check out the resources section on your webinar console and fill out the post-webinar survey. Thank you so much for joining us today, and we hope you have a wonderful afternoon.